Hello, today we will be discussing adolescent decision making when it pertains to medical life and death situations. This case involves a 16-year-old man named Trevor who was diagnosed with acute myeloid leukemia. He went on to receive several cycles of chemotherapy and other cancer treatments, such as radiation and a bone marrow transplant. Trevor went through 2 rounds of cancer and 2 remissions. Trevor was recently found to have relapsed again and is given a 15% chance at having 2 to 3 years of life if he chooses to go through an extreme regimen of cancer treatments. Trevor and his family are also given the option to transition to palliative care, which would likely only be 12 to 6 months left of life. Trevor's parents are wanting him to continue with treatment as a few years could see new treatments develop and become available. Trevor, however, does not wish to go through treatment again. Chemotherapy caused him to miss class and left him feeling lifeless. He has spent most of his adolescent life fighting this disease and does not wish to give any more of his life to it. He understands that this choice to not continue with treatment would likely lead him to die, but he wants to enjoy the remainder of his days instead of experiencing pain. In this presentation, we will be arguing for allowing Trevor to make his own medical decisions.
Our first argument is based on the mature minor doctrine. This is a policy in place in some states that allows a minor to be in control of their own medical decisions. It states that a minor can consent or refuse to their treatment if it is established that the minor is sufficiently mature to understand, discern, and appreciate the benefits and risks of the proposed treatment. In this case, Trevor has already undergone this treatment twice in his lifetime, meaning he fully understands what the process will entail from him. He also shows conscious awareness in his prognosis should he refuse the treatment, since he has stated he would likely die before the end of the school year. Given that Trevor is using all of this information to make his decision, he is showing maturity and informed consent in withdrawing from the treatment.
I will be talking about the second argument for Trevor making his decision himself. So, there is little evidence that minors of age 15 and above as a group are any less competent to provide consent than are adults. So this was taken from the third article that we read during class, and they basically conclude that ages 15 plus have similar cognitive and intellectual abilities to ages 18 plus. So Trevor at age 16 should be able to make the decision for himself because there are not any major psychological differences between the ages of 16 and 18.
One counter-argument for not allowing adolescents to make medical decisions is the fact that this age group makes decisions based off of social and emotional factors. It has been found that there is a significant deficit in the capacity of adolescents to make these decisions when compared to adults. It is not until age 19 when this difference becomes negligible. Since Trevor is only 16, he still is many years away from reaching 19 years old, indicating that he will most likely rely on social and emotional factors instead of reason in his decision making. The reliance has the potential to allow Trevor to make decisions off of how he will be perceived by his peers instead of what the best medical choice for his situation is. In response to this argument, Trevor has had to mature quickly for his age due to his diagnosis. He has the life experience to reasonably decide what the best option for his treatment should be since he has received the treatment twice before. In Trevor's reasoning for electing not to get treatment, he cites pain and wanting to live a good life for the rest of the time he has. He does not seem to be concerned with what his friends will think of him and how his hair falling out will affect his social standing. He is grounded in his reasoning and therefore can be seen to not rely on social and emotional factors in his decision-making.
Another possible counterargument in support of Trevor's parents making the ultimate decision is that parents are automatically given decision-making power with their children because they are expected to act for their children's benefit. They will generally have knowledge of what their child will want in the future based on their current values, and parents are also in the best position to make decisions for the whole family. In this case, Trevor's parents do not show malice or neglect. They simply disagree with their son about the total harm and benefit of the procedure at hand. Our response to this argument is that emotional and mental strain of the procedure should also be considered when discussing physical benefit. Trevor has undergone this treatment twice in his lifetime, and therefore is fully aware of the mental and emotional toll it will have on him if he chooses it a third time. His parents, however, may not understand the full consequences of the treatment because they did not experience it themselves. It is difficult to respond to these kinds of medical decisions if you are not directly involved, because without experiencing it, you don't understand the full picture. This is similar to our discussion about advance directives, in which patients, before experiencing the treatment, may have a different opinion on what they would want than they would during the process of the treatment.
This is the third counter argument. So there is a heightened concern for social expectations and consequent conformity in early adolescence. So here we're worried about their decision-making capability and if they can actually make the choice depending on their own values and not influenced by others in society. But an easy response for this would be that there is a negative relationship between age and conformity. So as you get older, there is a decrease in need for approval, and this decline continues into middle and late adolescence. So ages 15 to 21 compared to ages 11 to 14 are less likely to desire conformity. Trevor at age 16 is less likely to conform to social expectations and is able to just focus on him. So here he is more likely just to focus on himself and his needs rather than society's expectations or his peers' needs and wants.